All right, guys. So we look at the next question now, question 3. Please listen attentively.
The random blood glucose level of a 2-hour-old
Okay.
neonate delivered at Shotuba Health Center, Shagamu,
Okay.
was checked and noticed to be 32 mg per dl.
All right. Okay. So the question that follows A.
3A. What is the clinical condition the neonate is likely suffering from? 5 marks.
5 marks. What is the clinical condition this child is suffering from? The random blood sugar of that child born at what Shotubo Health Center is noticed to be 32 milligram per dl after 2 hours. So the answer is what? Hypoglycemia. But this child is how many hours old? 2. So, and that child is what? A neonate. So the clinical condition is what? Neonatal hypoglycemia. That's your 5 marks. Next, please.
3B. List any 5 possible causes. 5 marks.
List, please list. As you have in your notes. Infant of diabetic mothers. Full stop. Neonatal sepsis. Polycythemia. Hypothemia. Perinatal asphyxia. Growth hormone deficiency. Galactosemia. Congenital adrenal deficiency. The next one is what? Delayed feeding. So the question says you should what? You should list. So you don't need to what? Explain. Just list any 5 you can remember. List. Okay? The next question, please. C.
List any 5 possible symptoms and how you will treat the patient.
Correct.
5
any
marks.
possible symptoms and how to treat. Symptoms. Like we said, most of the neonatal hypoglycemia is usually what? Asymptomatic. But in this child, is what? 32. The normal sugar, the normal random blood sugar should be about what? 40 to 45, right? Above 45 is okay. But this child has 32 random blood sugar. So this is not going to be what? Asymptomatic. The symptoms that we can have is what? Seizures, lethargy, weak, not sucking breast very well. Irritability, that child will just be crying. Crying. And that cry is usually what? High-pitched. High-pitched cry or weak cry. Then tachycardia, if you check the heart rate, it should be very high. Then floppiness, the child will be very weak. Those are the symptoms that boy can present with. Okay, then how will you treat this patient? This is most likely going to be what? Severe neonatal hypoglycemia. Remember, in asymptomatic, you just do what? You just put the child to what? To breast. The sugar is going to what? Come back to normal. But for a child that has what? 32 milligrams per dl, 2-hour-old, it's symptomatic. Okay? So admit. Number 1 is what? I will admit this child. Number 2, you want to what? You want to give IV fluid. 10% what? Dextrosaline. For the dose, it's not for your level. Just know that we give what? IV fluid, and the fluid of choice is what? 10% dextrosaline. Okay? Then you can also do random blood sugar, 2-hourly check, 2-hourly RBS check. Okay? Then you correct other abnormalities, like you check for your full blood count. If the child is having sepsis, you check for your full blood count, you check for your growth hormone level, you check for your what? Full blood count will also tell you whether the child has polycythemia or anemia. The temperature of the child is very important too. So these are how we manage the child accordingly. Okay, so just list the points and you can explain, no problem. So I'll see you in the next video. Thank you.